Hi guys, welcome back to my channel. So I am going to be talking about OR nursing at a hospital versus a surgery center today. I have worked at both. I worked at a hospital in our local community for about a year in, I think it was 2021, and then, yeah, it had to have been because it's 2022 right now, yeah, and now I've been at a surgery center in the same city for, I think it's been like 5 months now or something like that. Yeah, so I'm just going to talk about the pros and the cons of both of them, and at the end I'll tell you which one I prefer. And also this video was requested, so thank you Mary Kate for requesting it. I appreciate it, and if anyone else has any requests, please just leave them in the comment section down below. Okay, so I'll get right into it. So I'll start with hospital pros. So at a hospital, if you are going in with no experience, you are a lot more likely to get hired into a hospital rather than a surgery center. It's not that surgery centers won't train people, they will. We have a girl at our surgery center that had no OR experience whatsoever, and she got hired in, and they kind of just did their own little orientation with her. But at a hospital, especially with COVID happening and people being so short-staffed, you are a lot more likely to be able to get a job at a hospital going into the OR. And then orientation for OR nursing is usually about 6 months to a year at a hospital. In my case, we were in the middle of COVID, and I was supposed to get 6 months of training. They ended up pulling me off at 3 months, which I felt okay about at first, and then it kind of freaked me out. Like, I was so stressed every single day, especially when we would have like neurosurgery cases, you know, people getting brain tumors removed, and I only had 3 months experience. Like that's super scary, super intimidating, so that was kind of a con to me. All right, another hospital pro is insurance, retirement, and pay. So you are more likely to get better insurance at a hospital. In my case, I actually get better insurance at my surgery center, which is awesome, but I do not get retirement at my surgery center. I did get a good retirement where the company, the hospital, would contribute to my 401k, so that was awesome. So now I'm kind of on my own with that, but that's okay. But that is one con to the surgery center. But there probably are surgery centers that do retirements. It's just not an option at mine. And at some surgery centers, they might not offer insurance at all, which would be a big con to most people, unless you were married and used like your husband's or your spouse's, whatever. In my case, though, I did get better insurance than I was getting at the hospital, which is awesome. And then pay. So pay is usually going to be higher at a hospital, or you're probably more likely to negotiate your pay at a hospital. Well, maybe. I'm just saying that because of COVID reasons. Hospitals are willing to pay a little bit more right now, especially like if you're with travelers and stuff. They're paying travelers so much money. It's crazy. But in my case, I got lucky again. And the surgery center actually matched my pay from the hospital, so that was awesome. But generally speaking, a hospital is going to pay more than a surgery center. All right, and the next one, this can be a pro or a con for people, kind of depending. You are going to get more hours, or there are more hours available when you're working at a hospital, and then you have the option to take call. Well, it's usually not an option. I was forced to take call. I did not want to take call at the hospital, but they made me. But obviously you get time and a half, which is awesome. So if you're looking for extra money, I would say working at a hospital is a better option for you, because you have the call, and then you have overtime, and there's just more hours available. So in my case, I was doing 5 12s in a row, and then I would get 5 days off, which was awesome. But I also had to take the calls, so it was just kind of like I felt like I didn't have a good work-life balance. Okay. Also, you don't have to clean your rooms at a hospital. They have housekeepers that do that. At the surgery center, we do have to clean our own rooms, but to me, that's not a con. I like to stay busy. I don't mind doing that, and we all work together. The nurses and the scrub techs and our managers even help us, and it leads to a faster turnover time, which the patients love, we love, and the surgeons love, so everyone's happy. All right, and then some cons, like I already said, call was a con to me. It might not be to everyone else, but honestly, when you work a 12-hour shift, or maybe that 12-hour shift turned into a 13 or 14-hour shift because a trauma came in at the end of your shift and you don't want to leave your team hanging, or maybe you were forced to stay, and then you have to take call all night, and you get called in at 2 in the morning, and you're there for a couple hours, and then you have to get up and go do your regular 12-hour shift again, and then do it all over again. It's a lot. So I'm not someone who runs well on no sleep, so that was not ideal for me. I hated it. I would pretty much cry every day because it was so stressful, and I was so tired, and I just feel like I was never seeing my friends. So yeah, that was a lot. All right. Oh, another thing I wanted to add to the pros of being at a hospital was, so you're gonna get a lot more experience. So you can take that experience and you can go be a traveler, where you're probably gonna go get paid more. At a surgery center, you're not gonna see the same types of cases that you're gonna see at a hospital. You're not gonna get any traumas. You're not gonna be probably doing any brain tumors or anything like that. So that experience that you gain can just make you more valuable as an employee later on. Not saying that you wouldn't be valuable at another surgery center if that's where you are working currently. It's just, like I said, you're just going to see more cases and more complex cases at a hospital rather than a surgery center. All right, another con. I already said hours can be longer at a hospital, but again, that might be a pro for someone. And then you have to work weekends and holidays. Obviously, you are going to probably sign up for whatever holidays you want to work, but you are forced to take some holidays. That's what kind of sucks about it. I didn't want to take any holidays. I love being with my family on holidays, love being with my fiance's family on holidays, so that's just, I hated it. I absolutely hated it. Let's see. And then a con for me was all of the traumas coming in, all of the schedule just was never structured well at a hospital. So you have all of the planned cases for the day, and then you have surgeons adding on cases, and then you have traumas coming in. So your 12-hour shift turned into a 15-hour shift pretty quickly. And obviously they're supposed to ask you, like, hey, can you stay today? We have this trauma coming in, we need someone, and you're supposed to be able to say yes or no, but you can't say no. I'm just going to tell you that right now. Well, I guess I should not say that for every hospital, but the hospital I was at, it wasn't really an option. It was like, yeah, you're staying. Or we're not even going to ask you, and we're just going to leave you in a room. Okay. A lot more stress at a hospital. Like I said, that has to do with the hours, the call, working the weekends too. We didn't have actual hours on the weekends, but we had to take call on the weekends, which you were on call from Friday night at 10 p.m. to Monday morning at 7, and then you would go straight into your shift on Monday. So that was not ideal. And you have to be within 30 minutes of the hospital, so you can't go out or do anything. So I would pretty much just chill at home. It was kind of boring, and we pretty much always got called in. So my weekends turned into working every single weekend. All right. Also, you are going to have probably a higher rate of staff turnover at a hospital. It's just how it is nowadays. People are leaving, people are quitting, people are not happy. Also, you have travelers coming and going, so you get used to working with some people and then they're gone. And same with like the surgeons, they got used to these scrub techs, these nurses, and now they have to teach these new people coming in how they like their surgeries done. So that kind of gets a little bit frustrating. It's just how the world is right now. It sucks, but it is what it is. To me, that was a con though. All right. All right, so I'll go into some pros of the surgery center now. I'll start off with just like a stupid little fun one. We do get a lot of free breakfast and lunches from the surgeons and our anesthesiologists, which is awesome. So nice of them to do. They don't have to do that, but I think they really care about their staff, and that's why they do it, which we all really appreciate. And it's awesome, but also not awesome because I gain weight. I can't pass up all the free food. So then I just eat the lunch they brought in and the lunch I brought in. So, just the extra calories. It's great. Okay, like I said, more structured schedule at a surgery center. This kind of, I don't know how to explain it exactly. So we have our scheduled surgeries for the day, and then, if we're only scheduled till noon, you get to leave after your surgeries are done, which is awesome, but also not awesome because you want your hours. So it kind of goes both ways. It can be a pro and a con. And then they also are only scheduling surgeries till 5 p.m. So you're pretty much, sometimes cases run over, sometimes we get behind, you never know what's gonna happen, but I don't think I've ever been at the surgery center past like 6 p.m. at the latest, which I love, but then like I said, some people might want more hours, so that's not ideal for them. Obviously no holidays or weekends at the surgery center, which I already said is a total bonus for me. I love the work-life balance that I have. It's so nice, knowing that I'm going to be able to spend the holidays with my family, knowing that I can have my weekends to myself. So I love that. Also, you are doing more routine cases. Like I said, you're not going to get really super complex cases. You might get some, but if you are getting more complex cases, like let's say a neurosurgeon works at the surgery center, he's not going to be doing like brain tumors and stuff at the surgery center. You can't do that. So you're going to get surgeries that are pretty routine and you can get really good at them, which I love. I love feeling confident in what I'm doing and knowing what the surgeons want when they want it. So to me, that is a pro. Not that I didn't love like working in the traumas and stuff and having that adrenaline rush. I did really like that, but for me, ideally, I get a lot of stress and anxiety, so working in like a stable environment is more ideal to me, I guess. Okay. Also, I feel like in turn, you kind of get to know the surgeons a lot better at the surgery centers. You're working with the same doctors every day. Not that you don't work with the same doctors every day at the hospital, but there are just more surgeons at hospitals, and you could be in different cases every week. And what was I going to say? Oh, there's a lot of travelers and stuff, so sometimes the surgeons don't really feel the need to get to know you at the hospital, if that makes sense, because they're like, this group of people is just going to be leaving in 6 months or whatever, so I'm not even going to bother. And at the surgery center, our surgery center is owned by our surgeons, so they really care about us and they really take the time to get to know us and everything, and we just have a really good relationship with them, which is awesome. Also, I feel like the teamwork that happens at the surgery center is really, really good. I feel like I did not have that at the hospital. Like I said, even the managers, they'll come in and help us clean, they'll help us set up all of our rooms. Everyone is just helping everyone out, and I really love the teamwork and camaraderie that we all have. It's a lot of fun. Okay, for cons, I already said surgery centers usually pay less, there's less hours available, no overtime options, no call options. Insurance and retirement options are usually worse. In my case, they are not, but they usually are. And then you have to clean your own rooms, which is not a big deal at all. And then one more thing. So at a hospital, if you want to take time off, you put in your request. You're usually going to get it off, depending on like how short-staffed everyone is. At a surgery center, they might not have as many employees, or they're probably not going to have as many employees, just in general. So maybe if you wanted time off and another nurse took off time before you might not get it off. If you let them know a good amount of time ahead of time, then you are most likely going to get it off. But that can be a little bit more tricky at a surgery center. But I will say they do try to work around our schedules a little bit more. Like, say I made a doctor's appointment, I've been trying to get into this doctor for months, and I'm like, oh my gosh, I got an appointment on Tuesday and it's Monday, and they're like, you know what, I can cover for you, no big deal, go to your appointment, come back when you can. Like, stuff like that. At a hospital, I feel like they're not really going to do that for you. They don't really care. So, I don't know. But overall, I will say I 1000% like working at a surgery center better. For me, it's just better fit. But if you are someone looking, to make a lot of money in a short amount of time, I would say go for a hospital, or go be a traveler, or go to a hospital first, get the experience, and then go be a traveler. And then if you want a better work-life balance, or if you just like something stable and structured, then the surgery center is going to be for you. But yeah, I think that is it for my video. If you guys have any questions about nursing, about hospitals, surgery centers, anything, or even if it's not about nursing, whatever, please leave it down below in the comments, and I will get back to you guys. And thank you so much for watching.